So now I'm going to perform hand hygiene. Hi, my name's Sadie. I'm going to be your student nurse today. Can I have your name and date of birth?
Hannah Adams, 7/12/1999.
Okay. Then I'm going to provide for privacy. I'm going to make sure I have a quiet and comfortable environment. So you've already told me your name. Can you tell me the date and where you are?
It is, I'm at my apartment and it's the year 2020.
Okay. So person is oriented to person, place, and time. So now I'm going to go ahead and inspect your face. So the color of the face is tan with a pinkish undertone, and the face is symmetric on both sides. No lesions or edema are present. I haven't seen any involuntary movements in the face, and I'm gonna go ahead and feel your temperature. So the face is warm and dry. Okay. So now I'm gonna go ahead and assess your eyes. So go ahead and look. Okay. So both pupils are round and equal on both sides. So now I'm gonna go ahead. I'm gonna go ahead and test for consensual and direct light reflex. So I'm gonna just have you look straight forward, and I'm gonna shine the light and look at you. Okay. Okay. So there was both consensual and direct constriction of the pupils. Now I'm gonna test accommodation. So I'm gonna have you. I'm gonna test accommodation. I'm gonna have you look at the wall, and then whenever I put my finger in front of you, I'm gonna have you look at my finger. Okay. Okay. Both pupils converged and constricted. So now I'm gonna go ahead and take a look at your lips. So your lips are pink. They're moist. There's no lesions, and it's symmetric on both sides. So you've been following my directions so far, so I'm going to go ahead and assume that your hearing is intact. So now I'm going to go ahead and look at your neck muscles. So your neck muscles are symmetric on both sides. There is not any lumps or lesions present, not any lumps or masses. The color is a tan with a pinkish undertone. So, and it's consistent with the rest of the body. So I'm going to go ahead and palpate for your trachea. Okay, the trachea is in the midline, and then I'm going to go ahead and feel for your carotid artery. Okay, the carotid artery is present with about a +2 force. So now I'm going to go ahead and inspect your anterior chest. So the anterior chest is symmetric bilaterally, the anterior chest. The color is tan with a pinkish undertone. It's consistent with the rest of the body. There's no lesions or masses or lumps. Bless you. There's no lesions or masses or lumps present. I'm going to go ahead, I'm going to feel the temperature. Okay, so it is warm and dry. So then, okay, so now I'm going to go ahead and palpate. I'm going to palpate your anterior chest. Tell me if you feel any tenderness, okay? Any tenderness? Okay, so now I'm gonna go ahead and, so there was no masses or lumps present. So now I'm going to go ahead and listen to your breath sounds. So I would clean my stethoscope, and every time I lay this on you, I'm gonna have you take a deep breath, okay? Okay, and then can you lift? Okay. So the lung fields were clear on the anterior chest. Also, I've been watching your respirations. The respirations are relaxed and unlabored, and the respirations were about 12 to 20 respirations per minute. And then now I'm going to go ahead and do your lateral field. So I'm going to have you lift your arms up for me. Okay, so I'm going to listen to the right side. You're also, whenever this touches you, take a deep breath for me, okay? Okay. I'm going to go ahead and do the same thing on this side. Okay, so the lateral lung fields are clear. So now I'm going to go ahead and go around back to the posterior side. So the posterior back is symmetric. It has symmetric bilaterally. It has elliptical shape. Its color is tan, or its color is tan with a pinkish undertone consistent with the rest of the body, and no lumps or lesions or masses are present. The skin is warm and dry. And so I'm gonna go ahead and palpate your posterior chest. So tell me if any of this is tender, okay? Any of that tender?
Nope.
Okay. So now I'm gonna go ahead and assess your breath sounds on the posterior side. So take deep breaths whenever I put the stethoscope on you, okay? Okay, so the posterior chest sounds were clear to auscultation. So now I'm going to go ahead and check your costovertebral angle. So I'm going to feel down at the 12th rib. I'm going to feel the angle right here. So I'm going to go ahead and palpate or percuss, and I need you to tell me if there's any pain or tenderness. Anything?
Nope.
Okay. All right, so now I'm gonna go ahead and assess the heart. So first I'm going to inspect the precordium, and so the apical impulse is not visible. So I'm gonna go ahead and palpate the chest. So I'm gonna start by palpating the base of the heart. Then I'm going to go down and I'm going to palpate the left sternal border. Okay, then I'm going to palpate the apex. Okay, So palpate those, and then I'm going to go ahead and auscultate for your apical impulse. So I would clean my stethoscope. Can you? Thank you. Okay, the apical impulse is present with a plus tube force, and normally I would count that and it would be between 60 to 100 beats per minute. It had a regular rhythm. So now I'm going to listen to the heart sounds with both the diaphragm and the bell. So I would clean my stethoscope. So I'm going to go ahead and start. I'm going to find the sternal notch and go down to the ridge and go to the right intercostal space, second intercostal space, and this is the aortic valve. Now I'm going to go directly over to the second left intercostal space, which is the pulmonary valve. Then I'm going to go down to the third intercostal space and listen to Erb's point. Then I'm going to go down to the lower left sternal border and listen to the mitral valve, or listen to the tricuspid valve, I'm sorry. Then I'm going to go down here and I'm going to listen to the mitral valve. Okay, and I'm going to do the same thing over again with the bell. Okay. Okay, and the S1 sound was louder at the apex and the S2 sound was louder at the base. So now I'm going to have you lay on your left side and I'm going to listen for extra heart sounds. So S3 and S4 with the bell, the stethoscope. So I'm going to have you raise your arm. Okay, I'm going to go back by the apex. Okay, no extra heart sounds were heard. So now I'm going to go ahead and, I'm going to listen to the left and the right bass. Okay. So now I'm going to go ahead and have you lay down and I'm going to assess your abdominal area. So the abdomen has a tan color with a pinkish undertone. I do not see any lesions present. I do not see any extra pulsations or movement. The contour is a flat contour. The abdomen is symmetric bilaterally, and symmetric bilaterally. I don't see any lumps or masses. Now I'm gonna go ahead and, now I'm gonna look at the umbilicus. So the umbilicus is midline, it is inverted, and there's no signs of discoloration or a hernia. So now I'm gonna go ahead and auscultate the 4 quadrants for bowel sounds, and I would clean my stethoscope. Okay, and I heard a gurgling sound in all 4 quadrants, and it had a frequency of about it would have a frequency of 5 to 30 times per minute. And it was a high pitched sound. So now I'm gonna go ahead and perform light palpation. So tell me if you feel any tenderness or pain in all 4 quadrants. Any tenderness or pain? Okay, so I would do that, and then next I would do a deep palpation on all 4 quadrants, which is about 5 to 8 centimeters deep. And then next, next I'm gonna move on to the musculoskeletal system. So I'm gonna have you sit up for me, and then I'm gonna have you take one of your sleeves off. Yeah. So I'm gonna go ahead and assess the upper musculoskeletal system. So I would assess the shoulder, the elbow, the wrist, and the fingers and hand. So the skin is tan with a pinkish undertone and is consistent with the rest of the body. There's no bruising or lesions that I see. The sizes are symmetric bilaterally. There's no deformities seen. The skin is warm and dry. And then, so the skin's warm and dry. I don't see any deformities. So now I'm going to go ahead and palpate. So I'm going to start with the front of the shoulder by the clavicle. And then I'm going to start going up the tip. And then I would go all the way around the back, and I would feel the whole scapula. Is there any tenderness or pain? No. Okay, good. And so next, now I'm gonna palpate your elbow. So I would palpate the grooves right here and the tip of the elbow. And then I would come down, I'm gonna palpate the wrist. Do you feel any tenderness or pain?
Nope.
Okay, now I'm gonna go ahead and take your brachial artery, or your brachial pulse. Okay, so I feel your brachial pulse. It's about a +2 with a regular rhythm. And now I'm gonna feel for your radial pulse. And your radial pulse is present, about a +2 with a regular rhythm. Now I'm gonna assess your nails. So your nails have the consistency is a hard palette of keratin. And I would assess for capillary refill, so I would press down on the nail, and it refilled less than 2 seconds. And then also, so I need to do capillary refill. And then there's no clubbing in the nails. No clubbing occurs. And then I'm gonna have you lay down, and I'm gonna do your, well, here, you can sit up. I'm gonna do your reflexes. So I'm gonna have you flex your elbow, and then extend it, and then I'm going to do a muscle test on you. So I'm going to go ahead and flex your elbow and try to push out for me. Good. Now I'm going to do it the same way and try to flex for me. Good. Okay. And then also, can you stand up for me real quick?
Yes.
I'm going to have you put your palms down and then face them up. Good. Now I'm going to have you lay down. I'm going to assess your musculoskeletal system. So the musculoskeletal system of the lower half, so there is no varicose veins or any vascular or abnormal vascular patterns. The legs are tan with a pinkish undertone. They are symmetric on each side. Legs are symmetric on each side. There's no lesions or edema present. No lesions or edema present, no masses or abnormalities. And so the temperature is warm and dry. And so I'm gonna go ahead and palpate for your lower half. So I'm gonna go ahead and palpate your hip. Tell me if you feel any tenderness. Do the side and the top. Okay, now I'm gonna palpate your leg, your knee. Any tenderness?
Nope.
Okay, now I'm gonna palpate your ankle. Any tenderness?
Nope.
Okay, so now I'm gonna go ahead and take your pulse. So I'm going to check your dorsal or your posterior tibial pulse. It's about a +1 force and it's present. And now I'm going to feel for your dorsal pedis pulse. And it is present with about a +1 force. So now I'm gonna look at the toes. So the toes have a hard palette of keratin. There's no clubbing present, and there's no, I would test the capillary refill, but there's nail polish on it. I would take it off at a hospital. And so it should be less than 2 seconds. And then I'm gonna go ahead and assess your muscle strength. So I'm gonna have you bend your leg, and I'm gonna try to pull it out. Keep your leg bent and don't let me pull it. Okay, good. So now I'm gonna go ahead and assess this. So I'm gonna put my hand here. I'm gonna have you press your foot down like it's a gas pedal. Good. I'm gonna do the same thing with this and have you point your foot up to the ceiling. Very good. All right. So now you're done. I would. Oh, actually, sit up for me real quick. I'm going to assess your hand grip. Sorry. Okay, good. And so the patient has had appropriate behavior and has been cooperative throughout this and been relaxed. The patient is oriented to person, place, or time, and the person's speech is very clear, has been very clear. So now I would make sure the bed's in the lowest position, make sure the patient has a call light in the bedside table, make sure the patient's comfortable, and I would wash my hands and leave.